Dr. Chris.
Yes.
Is activity, is getting fit, going to the gym, working out, jogging, is that more important than food for weight loss?
Strictly in terms of weight loss, no. People get very disappointed when they focus only on their exercise and not on the nutrition as well when they're trying to lose weight. And the illustration of this is easy. January 1st, if you look at the parking lots in the gym, they're cram-packed. You got to stand in line 3 deep to get to a treadmill or a weight machine. 3 weeks later, it's back to normal. The parking lot's half full. You can go in there and get on a machine pretty quick. And the reason is because people are going to the gym and they come home and they weigh themselves. And after a couple of weeks of realizing, well, I only lost a pound and I'm working my butt off, they get disappointed and they quit. Mm-hmm. And so there has to be a combination. Now, what I tell patients is that having said all that, I don't want you to quit exercising because it's the very best thing you can do for yourself overall health-wise. We have to exercise. That is the best preventative medicine that we have for a whole myriad of preventative measure disease prevention. But nutrition has to be combined with it if you're looking for the reduction in weight as well. Now, if we're looking at differences in percent body fat, that's a whole other issue when we're talking about exercise. But for waist circumference and weight loss, we have to eat the correct things. And so it really does come down to metabolism through nutrition and metabolism through exercise. And the very best way to do that is combine the two.
It's very important to tell someone, if they're not exercisers, is 10 minutes is better than no minutes. Mm-hmm. Let's start something. Let's get a routine going. And I feel like that's something that we miss out, or as a patient or as a person. Well, if I can't run a mile, well, I might as well not walk to the post office box. And, it's so different for every person. And so the combination of diet and exercise, absolutely, but start somewhere. Mm-hmm. If you're comfortable in your diet, then let's keep comfortable in your diet and work a little exercise in. If you're comfortable in your exercise routine, work on that diet a little by little by little. And people get overwhelmed. The January 1st scenario, everyone wants to go full force, but sometimes it's just the piece by piece that makes the largest difference in the long run, because you can keep it up and you can sustain it.
So we're talking more about, rather than fits and bursts, we're talking about a sustained lifestyle change, aren't we?
Absolutely. Absolutely.
Yeah. So if you've got 4 kids and you got to get them to piano lessons and soccer practice and all the other things that we have, then, you're probably in realistic terms, you're just asking someone to, maybe you can get a couple of 30-minute walks around the block on the weekend. I mean, if that's all you can fit into your schedule, it's better than nothing. And then if you reduce the 2 Cokes a day that you're drinking, by the end of the month, we've done some pretty good things. So it's just little things. If you combine 2 or 3 of them step by step, we can get to where we're going.
Yeah. Thank you.
I find some patients that I've seen really just want to keep eating the way they are, but they exercise their brains out all the time. And there's a problem. I mean, it's okay, I guess, if they want to do it that way, but there's going to come a time when they're probably not going to be sustaining that type of exercise, and then they'll gain weight. And I try very hard to talk to them about, let's watch what you eat too, and do intermittent fasting, which I've had a lot of success with people, including myself, to do. But just saying you're going to exercise and just, go to the gym and spend 2 hours. I don't know. I mean, there are people that can sustain that, but most won't. So
I kind of see it's quite popular in the kind of fitness world that a lot, particularly younger people, go to the gym and they eat what they like, drink what they like. They go to the gym, work out, like you say, chaotically, 2 or 3 hours a day, 7 days a week. But then they're filling their system with high sugar drinks to sustain the energy to get them through them workouts.
Right.
And although they may not be putting on weight because of the level of activity, surely that must have a really detrimental effect on their physiology, on their body and their health in some way.
It has to. It has to.
Yeah, I mean, if you think about those situations where they're in a good life situation where they can go to the gym every day and do all that, and then they're able to drink a sugary energy drink or something each day and not have any problem. Well, okay, what happens if they get a new job where they can't get to the gym but maybe twice a week, or they have an injury? And what's going to happen is if they don't make a difference or change their eating, they're going to see that weight go up, and then you at 10 years down the line, you're getting into some health issues. So there has to be some attention paid to the nutrition if you're going to be an overall healthy person. There has to be. And unfortunately, life events usually bring that to reality for a lot of folks who seemingly are healthy at healthy weights but don't eat well. Oftentimes a life change will bring that to the surface.
I'm starting, listening to all of your responses, I'm starting to see a general trend taking shape here, which is that lifestyle choices are critical at any age, at any level of health, and at any level of fitness. Because although you might sustain weight loss at a younger age but have a really poor diet, that lifestyle will continue with you as a trend through your own life.
Mm-hmm.
So no matter how healthy or fit that you may feel you are right now, it's still appropriate to adopt a healthier lifestyle, eating habits, activity habits at any point. Okay.
I really think a lot of people don't even know how to eat healthy. I really don't think they do. And this generation coming up they're just driving through Chick-fil-A and getting them some chicken nuggets. I call it the chicken nugget generation. And those kids won't even eat vegetables. A lot of them, they're like, no.
You have both sides. You have like the people who just eat fast food. And then I know a lot of like 20 somethings who will only eat organic, vegan. It's like to the other extreme.
It's another fad too.
Another fad.
Yeah.
Yeah. And they don't understand why their parents fed them chicken nuggets when they were growing up.
Well, they found out something with Dr. Google, and then they go to that side of it, right?
That's true. That's true.